The mental health crisis among healthcare workers is really critical at this moment. Healthcare workers are already working in an environment that is under-resourced. They don't have enough supplies, enough access to resources that they need to provide care. With the COVID-19 pandemic, that problem was compounded significantly.
They're tired, they're exhausted, they've been working in such poor conditions, they've been isolated from their family members, they've been also dealing with a lot of loss and grief, not only patients, colleagues, and even family members, and while also worrying about catching COVID.
In my organization, so many healthcare workers came down with COVID, and we are stressed out, we are burnt out because of the enormous workload there. And we don't have that requisite coping and resilience mechanism to help them.
It has created a lot of stress, psychiatric problems also. In 10 months, the suicide rate had doubled.
We are at high risk of shortage of healthcare workers if their mental well-being and their level of burnout is not addressed. Healthcare workers tend to see themselves as caregivers, so it's harder for them to seek support or seek mental health services.
The stigma on mental health in Kosovo is pretty high, and I think it's pretty high also among healthcare workers. So there are no specific services, let's say, or resources for healthcare workers how to cope with their mental health.
People don't have avenues to really talk about these things. It's never ever talked about in the public space. And I think COVID has really brought this very clear to all and sundry. It's very, very clear that this is lacking.
Pero de salud mental tiene una particularidad. Es para nosotros.
We're working directly with ministries of health and local partners to be able to strengthen their mental health systems and resources, raise awareness of the importance of mental health, and give healthcare workers direct skills and knowledge to be able to cope with the stressors they've faced in their response to this pandemic.
Healthcare workers learn how to identify common reactions to stress or trauma. They learn self-care techniques. They learn peer-to-peer support, stress management techniques, and how to seek support.
The materials were pretty easy to grasp and with very concrete suggestions on what they can do like right now, and then also some food for thoughts to what they can do in the future.
It has given us the opportunity to know that most of our behaviors or dispositions are due to distress. It has also bring up our consciousness about our staffs and colleagues at work, so that we will be able to channel them to where they will get appropriate mental health support and care.
When people are resilient, and are coping well with their day-to-day stress, it has a spillover effect in really making us resilient as a nation. And I look forward to where in every workplace you have a well-built mental health and resilience structures.